Hello, everyone, and welcome to Assure Learns. So glad that you're here with us today. So Assure Learns, what that's all about, it's a webinar series that we here at Assure Occupational Testing have put together to give you the training and knowledge that you need to effectively manage your workplace safety programs and help you have the confidence so that you can manage all of the occupational health needs of your employees and do that effectively. So we offer these webinars every other month. So we invite you to stay connected with the emails so you can stay informed about topics that are important to related to everything occupational health. That's our focus here at Assure, is everything occupational health. So our intention in putting these together is to make sure that you get the knowledge and education, the training that you need to make sure that your employees are well taken care of. And we also invite you to check out our YouTube page. We record these webinars and we post them afterwards to our YouTube page. So you can check that page out for other related webinars on topics like drug testing. Specifically, there's one around drug testing and THC, hearing protection fit testing, return to duty program. So check out the YouTube page for some of those if those are areas that you want to learn a bit more about. So today what we're diving into is physical abilities testing. I want to help you understand how this can play an important role in your hiring and placement process for your employees. It helps you as a company ensure you're putting the right worker in the right position. So my name is John Riccocci. I'm the founder and CEO here at Assure Occupational Testing. This summer, we just celebrated 15 years at Assure, helping employees ensure a safe workplace and make sure their employees are safe. So how we do that is we do it through these three things that are on your screen in front of you. We do it through drug and alcohol testing, whether that's urine, oral fluid, hair drug testing, many different ways that you can test to ensure fitness for duty of your workers. And we've got return to duty programs around that as well. And where return to duty programs comes into play is if you've got an employee that fails a drug test or is otherwise non-compliant with your company's drug and alcohol policy, an important question is now what? How do we appropriately return this employee to work if that's appropriate? So we help you get that employee assessed, create a return to work program for that employee, and walk you through all the steps from failing a test to getting them back to work long term. And we also ensure safe workplaces and fit for duty workers through occupational health testing, whether that's audio testing, mask fitting, physical abilities testing, which is what our topic is today, and as well as supervisor training. So we do supervisor reasonable cause training. We do that every other month virtually, and we're also available to bring that into your company, into your boardroom. And most of what we talked about, most of the services that we offer at Assure can be provided in our mobile clinic. We can bring this trailer. It's got 2 different rooms in it. The back half of the trailer is a soundproof room. We can do 4 audio tests at one time. And the front has got a washroom for drug and alcohol testing, mask fitting, any of the other testing. But let's get into today. So our agenda for today, like I mentioned, the focus is physical abilities testing. So we pick the topics for these webinars around, what are the questions that we're getting a lot from our clients, and what are some of the areas where people are potentially getting tripped up or not fully understanding. So we picked this one because we know this is a question that many of you have and still maybe not fully understanding. When do we do physical abilities testing? Who is it for? Are we required to do this? Is this recommended requirement? So make sure that you leave here with your questions answered. And at the end, I'm going to make sure that there's time to answer some questions. But as we go, feel free to interrupt, and you can unmute. You can put a question in the chat, whatever works for you. Make sure that you get your questions answered. If you came here with a question, don't leave here without it getting answered. So first, before we can even get into physical abilities testing, we first need to talk about a physical demands analysis, because that precedes physical abilities test. Then we'll talk about a health assessment and what the difference is between physical abilities and a health assessment, and then answer some of the FAQs that we commonly get here at our office. So as I mentioned, a discussion about physical abilities testing needs to start with a physical demands analysis. Because when you phone our office and say, I would like to book somebody in for a physical abilities test, or I want to add that to our account, we want to start to complete physical abilities testing for our workers. The first thing that we're going to ask you is, have you created a physical demands analysis? If so, can you forward that to our office so that we can give it to our nurses who are going to complete your physical abilities testing? So what is a physical demands analysis? It is a document that identifies the physical requirements and the essential tasks of a job. So it's a it's 1, 2, 3 page document, 4 page. I've seen some that are 5 pages, and as little as probably a 2-page document. So, and it's document that is completed specific to every individual position in a company. Every individual, I would say physically demanding position that is in a company. So that's completed, and then that would be provided to us, and that informs the nurse or whoever is completing the physical abilities test. That informs them, it gives them a document, a benchmark to say, how do I determine whether this worker is fit for the job that the company is wanting to hire them for? Well, this informs the nurse. This is the information that the nurse needs to be able to say, yes, at the end of the physical abilities test, in order for that nurse to be able to say, yes, this worker is fit for that position. But without certain information, that the person doing the assessment isn't able to say, are they fit for that position or not? This physical demands analysis provides the nurse the information that she needs to say fit for duty, not fit for duty, or we need more information. So reading that second bullet point there, the physical demands analysis involves a comprehensive review by a qualified professional to identify essential job functions. So we'll just stop there. Qualified professional who completes a physical demands analysis is an important question. Someone who's qualified to, so sometimes these can be people in a kinesiologist, a physiotherapist, occupational health physician, a nurse with specialized training to complete physical demands analysis, someone in HR, again, who's qualified and has additional training to complete these analyses. So it's someone who's qualified, someone who knows your job, knows the ins and outs of the positions in your company. And what are they doing? They're identifying, carrying on with that second bullet point, that they're identifying essential job functions, looking at what manual handling is required of that worker. What's the dexterity requirements? Positional mobility demands. Are they bending over? Are they lifting? Are they twisting? Is it repetitive motion? Or are they on a conveyor belt on the line just doing the same motion over and over? Or is this an electrician who needs to climb a ladder? Is this an oil field worker who needs to be able to lift 80 pounds and then lift it above their head? So these are the specific kind of details that the person who's completing this analysis is going to document, saying, in order for the person to work as an electrician in this specific job in this specific company, here's the specific things that person does on a typical day. So other things that they might look at that this analysis, the PDA will outline, PDA physical demands analysis. Look at strength, what strength is required. Again, what amount of weight is going to be lifted, frequency. So if it involves, does it involve walking? Well, if it involves walking, for example, the PDA will say it maybe involves 1 hour of walking per shift, 1 hour of sitting, 1 hour of, so sustained hold might be 30 minutes of sustaining a hold of lifting or holding or carrying weight. So the amount and the time they need to do it, what position are they in? So it's all about, so again, the PDA is about identifying the specific job tasks for a specific job on a typical workday. So here's a few other things. We'll go into a few more details about what the PDA can, what can be involved or included in a PDA. And again, I want you to know this because we get a lot of questions around this, and I know it's easy to get confused around it. PDA, physical abilities test, the PAT, what's the difference? I thought they were the same thing. I finally figured out that we need to do physical abilities testing, and now you're telling me I need to go and do a physical demands analysis. So there can be some steps to this, and rest assured that we can assist you with every one of these steps. We've got trained staff that could come to your site to complete the PDA for each of your positions, if that's something you require. If you've got someone internally who's qualified to do that, great. If not, and if you need support with that and documents, reach out to us. We're happy to support you with that. So here's some other things that can be included in the PDA. The job title, what department, the location, because carrying on with the electrician example that I brought up, one electrician in one location or department of your company might have different requirements of a different electrician. So you want it to be, again, job, location, position specific. It'll talk about work schedule. What's the typical shift? Is it an 8, 10, 12-hour shift? What's the frequency of the tasks that are outlined? So we'll talk about physical activities. Is there standing involved? Sitting, bending, kneeling, crouching, crawling, reaching, twisting, climbing, what movements, walking, running, any repetitive motions, and again, the frequency, how often are each of these motions and tasks happening? So other things that are typically included in the PDA, force and weight requirements. So if there's lifting required, what's the maximum and typical weights lifted? So a common question that you'll get from us is, what's the maximum from us at Assure, if when your company's ready to start physical abilities testing, is what's the maximum amount of weight lifted for that position required? Is it 25 pounds, 50, 88? FYI, the max that we do in our office is 88 pounds. And then there's something called an awkward lift. Some positions, it's not just a nice square box that you're always lifting. Sometimes maybe it's a bag of seed, it's a bag of cement, so it's awkward. So we have bags in our office to simulate an awkward lift, for example, where a worker might have to give a bear hug to a bag while using proper lifting and maneuvering techniques. So carrying distances, weights carried, is there pushing and pulling involved? So again, the PDA set is someone that physically goes on site with a worker on a typical work shift, documents these tasks, these requirements, creates the PDA, provides it to our office. Our nurse, who's doing the assessment, the physical abilities test in our clinical setting, then recreates each of these tasks in a clinical setting. That's what happens in a physical abilities test. So pushing, pulling, gripping, handling. So we've got instruments that test grip strength, for example, of workers to see, is the grip strength, does it meet the requirement, the minimum requirement for that specific position? Tools, carrying on. What tools are used, equipment, ergonomics, task, duration, and frequency. So again, in a typical PDA, you can find templates and other examples online, of course. And this is a common thing that you'll see. How often is that specific task completed? Occasional, frequent, or constant? So, but beside each of the tasks, that will also be laid out in the PDA. So again, this last paragraph here is speaking to who can conduct or create that physical demands analysis document for your company for each of the positions that require physical abilities testing. Who that is it's an occupational health specialist. Here's a few examples. An ergonomic consultant, human resources professional, a nurse, kinesiologist. There could be a few more added to this list. Nurse, kinesiologist, physiotherapist. And it's also informed by observations and interviews with workers and supervisors. Because an important piece is when the assessor is on site doing a PDA, you want to talk to other people and get all the information possible so that we're trying to simulate a typical work day, but a PDA is typically conducted on 1, maybe 2 days. So it's maybe not necessarily indicative of a typical shift. So they're going to do some interviews to get as much information as possible. So that's the PDA. again, a PDA comes first, which informs it tells the nurse in our office, the assessor, how to recreate the workplace tasks in a clinical setting. So that's what we're doing in a physical abilities test. In our office, we need to recreate those tasks. So a physical abilities test is an assessment which safely mimics the essential physical requirements of a job in a clinical setting to objectively measure their physical abilities. So a little bit more about the physical abilities test. Talk about now on the screen, I've got a few common questions that we get. One of them is, why is it recommended? And, a similar one is it just recommended or is it required? Well, you get to check, your industry and your governing bodies. Some of your employees may have a governing body that will require them to do such testing. So you get to, I can't speak to all of them, of course, but there are some that will require this. Generally, it's recommended for employers to do for these reasons. It will reduce workplace injury. Sprains and strains caused by overexertion are one of the most common workplace injuries. So completing physical abilities tests helps you, find out what are the limitations of a specific worker. Are they adequately equipped for this position that we're considering them for? Second bullet point there, it'll help you determine whether a worker can meet the physical demands of a specific job. But how do we know, again, what are those physical demands without completing that PDA? PDA gives us that. Then we test to see, is that worker, can they do these tasks? Helps you know, is this the right fit for this employee? And if not, then maybe there's a better position for them. Another point why it's recommended, it helps you align tasks with worker capabilities. Again, if this isn't the right position, let's find one that maybe is, if you've got one in your organization. It also helps you as a company minimize claims and lost work days due to injury, because you're not going to put a worker in a position that they're not physically capable of completing. It helps you increase retention. So if somebody gets, if you put the wrong worker in the wrong position, they're likely not to last. If it's physically too demanding for them, for example, they're likely not to last. And lastly, it's a risk mitigation tool. It's one of the best ways that you can minimize WCB claims, keep insurance rates lower, reduce injuries, incidents, many reasons why it's recommended. So when do you complete a physical abilities test? Pre-placement, before a person goes into a position. So you've identified someone that seems like a good fit for a position. One of the last things that, they've got this right certification, the qualifications are there, the courses are required courses are those requirements are met. Now we want to find out, is this person a good physical fit? So pre-placement, or return to work after somebody recovers from an injury. They've been in that position for a while. Maybe they've been off, they've been on leave, they've had a claim, they've been off for medical or injury reason. Now we want to consider putting them back in this position. You may say, we as a company want to do our due diligence and make sure that we are properly assessing them to see, is this person actually fit to go back in that specific position? Is now the time? Do they need more time? Is there other medical clearance required? The last point here, when it's helpful to complete a physical abilities test, is if someone's transitioning into another role. So the first one may be a new hire. First bullet point there, pre-placement, maybe speaking to a new hire. The last one is now talking about someone who's been on your payroll for some time. Now they're moving into a different position. Again, physically demanding position, and you want to make sure, is this person fit for that new position? So what can you expect during a physical abilities test? So when someone comes into our clinic to complete a physical abilities test, one of the first things that they're going to do, that the nurse is going to do with this individual, is they're going to take their blood pressure and their heart rate. It begins with that. It begins with the health screening to see, is this person physically fit to complete the physical abilities test? Because the test in itself is very physically exerting. Most of them are working up a sweat. Most of them may need to take a break in between some of the exercises. It is a physically demanding test, so we want to make sure before we submit someone to this, we're going to do an initial health screen to see is this person fit to continue with the testing today. So once a person passes that initial health screen, then we're going to ask them to come to simulate some specific tasks. Again, the tasks are where we're getting those tasks from. We're being informed by that PDA. So using standard functional testing equipment, such as weights, ladders, and stairs. So what that can look like is we have a ladder, for example, that goes completely to the ceiling, because some of the PDAs will say a worker needs to climb 3 stairs, 5 stairs, 7 stairs, or steps, sorry. So then they'll have to climb the ladder up that amount and maybe do that 5 times up and down to demonstrate that they can do that with ease. And then we've got stairs that they need to, that again, if the PDA says this position requires stair climbing, then again, we'll simulate that in our office. If it identifies weightlifting, a person must lift 25 pounds over their shoulder and sustain that for X amount of time, then again, we'll do that and simulate that. If it requires manual dexterity at shoulder height, below, above, whatever the PDA identifies, then that will be simulated. One example there is, putting an example of a task that they'll be asked to complete is threading a nut onto a bolt to simulate the manual dexterity, doing that above, at shoulder height, and below as an example. Some other tests may include lifting, pushing a weights in a box, carrying, pulling, gripping, climbing, and back exercises. Some back exercises would be to lay on the some examples. I always like giving examples because I want to know what can we expect when we send a guide to your office? What help us inform our employees so they know what to expect? Because sometimes they don't, and they can come into our office and say, nobody told me I was going to be sweating today. So it's good for everybody when an employee, when you as a safety manager can properly inform your team to know. Just so you know, when you go to Assure for this test, you might want to take some running shoes. You might want to take some clothes that you're okay sweating in. So back exercises, lay on a mat on your stomach, raise your legs, raise your arms out in front of you, get into plank position, do sit-ups, push-ups, squats. So again, it's a physically demanding test on purpose to see, is this person, can they handle the level of exertion that's required for that position. So another good question is, when would a physical abilities test be discontinued? So in the midst of doing this, even though a person might have passed that initial health screen, testing has now started. If at any point a worker says, it starts to feel pain, discomfort, dizziness. Discomfort, of course, it's never, most people are going to feel some discomfort when you're doing some push-ups. So it's more than the normal that would come that would normally be experienced from this kind of exertion. But pain, discomfort, dizziness, limited range of motion, or other health concerns that the nurse or physician would identify during the assessment. So they might just stop and say this employee is not fit for duty, or they may say not fit for this position, sorry. Or they might say, we need to stop and I just need to get them assessed by their family doctor, by another physician, something that's specific or appropriate to what the symptoms that they're seeing in the moment. And they might say, I'm willing to continue this test once I get this specific thing cleared, then they can rebook and come back and we'll continue. So what are some of the outcomes of a physical abilities test? So when I send a worker for this testing, what is Assure going to tell me? So here's what you're going to get as a company, as a safety manager. You're going to hear from us that this worker is fit for duty, not fit, or we need some more assessment. The nurse is not saying yes, they're not saying no, they're just saying, I want a bit more information. So what does that look like? So fit means it's just they're able to complete everything that's outlined in that PDA. In the physical demands analysis, the nurse is saying, my professional assessment is that this worker can complete all tasks outlined in the PDA. Or it might say not fit. So what do you, as a company, do at that point? You may say, we're going to find another placement for this employee, but identified a worker that we'd like to hire. This position isn't a good fit for them at this time, but you might say, where else can we fit this person? Or you might just say this person is unsuitable for the position, and then position is not offered, and you might choose not to continue with that employee. Or finally, you might get the result of pending further assessment, meaning now what do you do in that situation? And the nurse is going to make recommendations here, and it won't just be, leaving you as a company hanging. We're going to give you specific referrals. Need to be assessed by an occupational health physician, for example. We want to reach out to their general practitioner. Maybe they've identified a pre-existing condition and want clearance from a physiotherapist, for example. So there could be more evaluation by any one of those people may be required. And again, if that's what comes back to you when you get the result, of course, feel free to talk to us. You can phone and ask to speak to the nurse who completed the assessment, and she will give you help you with referrals and next steps. So a few other frequently asked questions. So when to renew a physical abilities test? Is this something that we just do upon hire when they're placed and kind of never look at again? Is it recommended to do every couple of years? So here's some thoughts around that. When to renew or to complete a follow-up physical abilities test. So again, if they're returning to work after recovering from an injury, it's recommended that you as a company, best practice would be, let's make sure this worker is fit for that position. Transitioning into another role within the same company. Again, some of these we've covered before. When do we do these initially? But they also apply now in the future. When do we redo it? If now they're going to another role in the same company, or there's a change in the physical ability of the employee. Could be related to an injury, something like that. Another common question is, what positions require a physical abilities test? Are we testing the receptionist? Are we the maximum, the stapler is maybe 2 pounds, or do we need to get her assessed to see if she can lift a 2-pound stapler to staple its documents? You as a company get to decide this. You might say, no, that's probably not required. So I would generally say it's physically demanding positions. I'm not going to get any more specific than that. Physically demanding positions. Positions where there's an increased potential for risk or injury to the worker based on past experience. Physically demanding positions. Industries, a lot of the industries that we are seeing that are completing this testing, oil and gas, of course, trucking, mining, the list could go on, but it's any physically demanding position is the best way that I would put it. So who's qualified to administer a physical abilities test? Briefly went over this, but again, a nurse, a physician is the most common ones. That's who we most commonly use. Mostly what we're doing in our clinic is nurses at some of our, collection sites that we use across the country. Most of them are using nurses, RNs, LPNs, but also some may have occupational health physicians. If it's a nurse, it can be physician reviewed. So you as a company might say, I'm more than comfortable with having a nurse complete the assessment, but I want it to be reviewed by a physician. So in that instance, then we get those ones reviewed by our occupational health physician at Assure. So another question that we get is, I've heard about a health assessment. I thought that was the same as a physical abilities test. What's the difference? So just to say a bit about that, a health assessment gives you as a company a general picture, the big picture, the overall assessment of worker health. So how these are completed are largely on questionnaires that an employee completes in our office. So when they come to Assure for an appointment, they'll be in the waiting room, they'll be given a number of documents to complete, and they'll fill that out on their own in the waiting room, which is then reviewed by the nurse verbally. So they review everything in the document with them, and they're asking clarifying questions, getting more information, digging deeper into things as needed. So generally, it's of course the health screen, blood pressure, heart rate, the basics like that. But then talking about family history. So this gives you a big picture, and it will identify that any previous illness or injury that we as a company that would be good for us to know to decide is this worker fit in this position or not. So again, I look at it as this is the big picture, more of a general assessment of the worker's overall health. It's different from the physical abilities test, though. Some companies are doing both of these together. I want a health assessment done, and we want the physical abilities test done on each worker upon hire, for example. So they can be combined, but again, just to be clear, they are different tests. So the physical abilities test, again, is position specific. Health assessment could be done just for any position. Physical abilities test requires the PDA, which should also be on this list, requires the physical demands analysis to be completed. Health assessment doesn't. Physical ability test is specific, and again, it involves the weights and the exercises. So if there's other questions, I tried to come up with all the frequently asked questions. I talked to Carrie, our operations manager. What are you hearing on the phone from employee or from managers and owners of companies that are booking these tests? Talk to the nurse. What are you hearing? Trying to answer the most commonly answered questions. But if you've got more, again, feel free to unmute, ask them right now, write them in the chat, or our information is on the screen here. Don't be afraid to reach out, of course. John@assuretesting.com is my email, Jon for John, and phone number is there on the screen that you can reach out at any time. Happy to get on the phone and talk about your safety program, your drug and alcohol policy, any questions that you've got around it. And before I let you go, we just want to make sure that you know about our upcoming training. So we do these webinars every other month, and in the in-between months, we do supervisor reasonable cause training. So that means on January 22nd, hard to believe that 2025 already in just a few short weeks, but on January 22nd, supervisor reasonable cause training is coming up. This is a virtual training. So just like we're doing right now, you can get your managers, your leaders, your supervisors trained to know how to properly and effectively deal with a reasonable cause situation in your workplace. Reasonable cause, again, what we're talking about is if somebody is not fit for duty because of the use of substances, drugs, alcohol, medications, you want to be able to properly handle that as a company, adhering to occupational health and safety in your province, as well as Canadian human rights, and maintaining employee confidentiality and overall safety in your workplace. So if your supervisors have not been signed up for that training yet, this is vital training for all of your team. Make sure they get on the same page. Watch your emails. Carrie is going to send you emails probably the next day or two to sign up for that. So as always, don't be afraid to reach out. We're more than happy to connect with you about any questions you've got around managing your workplace health and safety program. So thanks again for being here today. It's been a pleasure.